Now we were moving on towards narrowing the differential diagnosis that we have at our hand, and we have obviously narrowed it down through the deep history and the physical examination. We are moving on towards the lab findings particularly. We'd be focusing on a complete blood count. A complete blood picture is very important. And over here, obviously, for instance, if it is a white blood cell count which is raised and the ESR is raised, it is basically suggestive of an inflammatory condition, particularly. It can be, for instance, an appendicitis that we're dealing with. Electrolytes are very important, because if we want to replace it, we must know that there is some sort of an electrolyte imbalance that the patient is suffering from. BUN, that is the blood urea nitrogen, also has to be calculated and corrected accordingly. Creatinine levels, because we want to look for the renal function tests as well. Any kind of a distortion in the renal function tests can be suggestive of the fact that the origin is from the pelvic region, the kidneys are responsible, or there's some kind of a stone that we are dealing with. Glucose levels are obviously completely monitored, and obviously hypoglycemia has to be battled, particularly when we're dealing with pain in abdomen. When we have female patients and they're suffering from an abdominal pain, we must rule out the pregnancy first of all, and that is carried out for these patients. And iron deficiency anemia is one of the major causes of a generalized abdominal pain. Even body aches is one of the features over here. So you have to rule that out by carrying out the iron studies for the patients. So these are the lab investigations that we can basically focus on. Moving on, the radio imaging techniques that we can resort to, we have the CT scans particularly. They're more invasive, they're more basically suggestive of the fact we can have the contrast enhanced CT scans, again suggestive of any kind of an outpouching that is present in the small intestines, any kind of a colonic rupture, any kind of an abdominal aortic aneurysm that we might be dealing with. So all of these life-threatening conditions, appendicitis, all of these can be ruled out when you carry out even the least of all the ultrasound can be carried out. And if it is suggestive of something, we can carry out or resort to the CT scans, or we can have the more invasive techniques. For instance, the colonoscopy is done, and for that, basically, we are ruling out any kind of masses in that particular area, or even IBS, or even kind of ulcerations, ruptures. All of these can be basically ruled out when you have these imaging techniques at your hand.